gain of function. Anybody ever heard that term? I don't want everybody to raise their hand. See, I always give you guys pearls, right? These are like pieces of information. Okay, so how to best describe? I have 6 children. 2 are vaccinated. Those are the 2. One's a veterinarian and one's a doc practicing in the hospitals they were in. They had to. The other 4 didn't. And so whenever we're sitting around the table, conversations would come up. And as we all know, there's different ways to handle children. You know, seen and not heard and beat them, or allow them that open forum at all times. So I try to do the latter, okay? And the conversations that would come up, especially the physicians would say, but we don't have this data or this data or this data. And so if the idea of the COVID virus, which Newsweek will tell you about, is that the virus was transmitted in Wuhan, China. Imagine the strip district where they're butchering animals. And so they had bats and some of these other animals, and they would butcher these animals and let them bleed into the rice. And then that's what they eat. Okay, so conceptually, I mean, I listened, I learned, I saw, and I paid attention. And so information that came to us from the CDC or the National Institute of Health, we paid attention to, we understood. It's what's called an RNA virus. What you want to understand with this, guys, is conceptually, it's really easy to understand, but for some reason, they didn't make it easy for us to understand, okay? So what's an RNA virus? All right, let's see how good of an artist I am. Okay, you guys ever heard of guided imagery? I'm going to guide you through this image, okay? It's not a female with her eyelashes missing cartoon, anything like that. This is my drawing of the old tape recorders. You guys remember you'd hit the button, and then this piece would hit the piece of tape, and it would be a recording. This is what you want to know about RNA and DNA, okay? There's what's called messenger RNA, transcription RNA, and ribosomal RNA, okay? And how does it take place? The DNA, which we have, humans have DNA. I'm just gonna keep that on. Has the blueprint, the RNA does the work. What's the work? This is the concept I use. Medical school, I wouldn't be a doctor if it wasn't easy. You know, we had eponyms for everything. You had ways you remembered stuff. And this is what the professor talked about. So what you want to think about is the message is coming, and this pushes against it to get the message, so that's the transcription RNA. And then it takes the message to the ribosome, which is where everything happens. That's the workhorse of the cell. All right, so everybody understands that concept. All right, so over the years, I've been doing this since, let's say in the 70s, because there was docs in the family, I got interested in research and things. So I've been paying attention for, what's that make, at least 50 years. And in that time period, information that comes out is vast, a vast amount of information, so that everybody critiques it before it becomes the standard. Well, what happened with COVID, it was a pandemic, and so everything was a rush. And so a lot of the information you accepted because this is the NIH, this is the CDC, this is how everything is. So at the table, and again, data, December 31st, 2019 is when this occurred, meaning the first case in Wuhan. All right, does everybody follow me? Understanding the RNA is very important as we talk about the vaccine. So does everybody understand that? Good. All right, so what happens now, that's my bookie. So what happens now is that we end up with the pandemic, and we come up with vaccines, and we know the corona virus has spikes. Ooh, wrong way. Wrong way, Joe. Okay, everybody understands the concept. How do we know this? In 2002, that was the severe respiratory virus called SARS-1. That was in 2002. 8,000 Americans, because it started in the Middle East, 8,000 Americans got infected, 8 died. In 2012, SARS-2, in between, they had the Middle East virus, didn't kill anybody in America. Whenever the SARS-2 came out, there was about 12,000 Americans infected, 2 died, okay? So you have a virus, you don't want anybody to die, but the flu that we get immunized for takes that many people in America, okay? So did we worry? Yes, I mean, you always want to get vaccinated. I gave many flu shots over the years out in the communities. I think it's a good thing. And so what happens now with the pandemic and what we know of the coronavirus, and then the, first off was the swabs to test, went up through the nasal pharynx, because the important difference with this virus was respiratory droplets. Also can stay on surfaces. So this made it more virulent is how it was presented to us, okay? And so now we have the virus. 2021, we know because we work here, you know, you get the swab, you have to make sure that you're negative. If you're not, then you have to, if you're healthy enough, you have to quarantine. If you're not, you may need some medications. If you have respiratory problems, you definitely need those, okay? Statistic, 80% of hospitalizations during the COVID pandemic, over 75 years old. Does everybody follow me? So the vaccine's important. Don't lose sight of the vaccination helping your body's immune system. But as a physician, especially whenever I'm sitting at the table listening to the conversation, they asked me about a story I told them in 1983. I was in Texas. Anybody ever heard of Stanley Kaplan Educational Center? Okay, Stanley Kaplan centers are across the world, all through America, and you can come over on a visa to study. And so they're excellent places to prepare for tests. So I prepared for my boards there, other people were there, so I was at one in Texas. And the guy told me, anybody heard of a bacteriophage? What this is just like with the virus, the RNA virus needs DNA, and we'll talk about that. You need, usually it's called a host, all right? What scientists were able to do was take that bacteria that's dividing and use that energy. And so this is early 80s, 83, 84, I'm in Texas, and the Russian guy that was running the place told me that they had a monocle with a computer that was run by a bacteriophage. And I didn't believe him, okay, because at the time this was all new science that was coming out. Again though, what you must understand is that the genetics, the cellular function, and the genome, that's something we need to understand. Let me turn this page. Remember we talked about the DNA, and we'll call that a host most times, and the RNA, and remember my tape recorder. Okay? So what happens is, the theory was that the blood droplets from bats in Wuhan caused a change in virulence. Remember what I said, 8,000 people, 8 died, 12,000 people, 2 died in America from SARS-1 and SARS-2. Remember, what SARS means is severe respiratory problem. Okay, that's how you want to understand that. So now we have the bat transmitting to a human in Wuhan, December of 2019, and there was a knowledge of a pandemic coming. Like, this one's going to be virulent, and it's coming, okay? Keep that in mind. And again, all this is in the article. You know, we didn't talk about this in the past because I didn't know factual data. These are all theories. When you see Newsweek, they list all the sources, and they finally talked about gain of function, okay? Understand that concept. So now we have this coronavirus. I'm drawing those wrong. We'll just put one line, okay? We have a coronavirus. The first 2 took out a total of 10 people from 2002 through 2015. And in 2019, this one comes along, bat to human, and it's the most virulent COVID we've ever seen. And there's a lot of COVID viruses around. You know, the common cold has COVID in it. Most of the shots you get for your flu is protecting against COVID. So it's not like it's a rare, never around virus. It's been around for eons. So again, as we look at the data, we look at the information, we see the treatments that are coming out, we recognize the severity of the respiratory disease, especially if you have a weakened immune system or any respiratory disease. And so you have to get the vaccine, you have to protect yourself. These are things you have to do if you're in that risk area. And I recommend you talk to your doctor to make that decision, because you have to protect yourself. And remember what I said, 80% of the hospitalizations were people over 75. So again, at the table, the discussion came up of gain of function. I know what it is, I knew all about it, but I learned when they're fighting, you don't pick sides, you just let it go. So the one saying you're a conspiracy theorist, and the other one is saying, how can it change the virulence like that unless you saw the animal, that's my veterinarian, unless you saw the animal population all of a sudden have a rise in the COVID or a change in the COVID. So if we're saying the bat transmitted it, so that was her argument. And I just listened, and I never saw anything come out nationally. So I just accepted that this is what it is and this is how it is. And just, as I told you, that's what I advise my patients. You know, stay away from people, put the mask on if you don't have to go anywhere, especially when the pandemic was in play. But now that the pandemic's over and some of the information is coming out, what we look at, gain of function. Okay? What you want to think about is a cell is like this. The center, nucleus. All around here is called the cytoplasm. And we talked about the ribosomes. Okay? So what you have is the genes you inherited from your parents, and you can scrape your cells and see all your genes that you have. It's called a genome, where they take a picture, literally, of your genes. And over the years, the technology has advanced to the point that they can actually get to the gene that causes the virulence. Does everybody follow me? So SARS-1, SARS-2, that took out a total of 10 people in America when it hit America. And now all of a sudden, we have, the statistics are somewhere between 4 and 5% of those that were infected in a hospital with COVID passed. But the data still isn't out at the NIH, and I'll give you all that information. But how this all went forward for me was, okay, so the bat bled, they eat it, they take in this virus that's in the bat system. There was no change in the environment of the bats that was discussed and found through the veterinarian side. And now it's so virulent that we're all being warned about it, prepared for it, and ultimately 2 vaccines came out fast. And I think that was Pfizer and Moderna came out first. And then after that was Johnson & Johnson. And then same thing with the boosters. I recommend to all my patients, if you have any chronic disease states, or if you have immunocompromised problems or lung disease, definitely get the boosters. You know, now that we're through it to the point now where they're talking about new ones that may be coming out, same thing. You're well informed here, well informed. So you will get the information plenty of time to make decisions and ultimately speak to your doctor, okay? So now let's go to the gain of function. Once again, it is in the Newsweek article, January 25. This information I get from the NIH, and the date of this one was July of 23. What you will see in the article with Newsweek, they use the word Wuhan hosted several research laboratories. And America had one there, okay? Again, in Newsweek, guys. So just read the article. So what are the laboratories in Wuhan doing? Gain of function, okay? So if we're doing gain of function in Wuhan, what is a theory? Did it happen? We don't know. But what's a theory? They call it lab accidents. All that is in Newsweek. What does that mean? I worked in the lab before. Let's say a pipette is a way that we take solutions. And so you dip the pipette in, put your thumb on it, measure it out, and then you have to put it in a test tube. And then we centrifuge it. Different things that you do. As long as you take your time and you're cautious, usually not a problem. But I've been in many labs since the 70s, as I said, accidents occur. They shouldn't, but they do. So Newsweek calls this the mystery, and what they say, was it a lab accident? Okay, so back to the discussions that we're having. So with the discussions that we're having, the conversation comes up that, okay, so if there was a gain of function manipulation of the virus, what's the purpose? And that's the research. Okay, the genome can identify what gene causes the virulence. Why is that important? That's what you attack with the virus, or with the vaccine. Does everybody understand? That's what the research was all about. Because they had 2, again, these are severe respiratory problems, SARS-1, SARS-2. Thankfully, Americans didn't suffer from it because it wasn't a virulent virus. With the gain of function, thoughts that because how virulent it was, and the fact they were actually manipulating the genomes to find that gene, that was a theory. Is it proven? No. I just read the stuff a week ago. So nothing's out that has proved it. But the NIH, it's called the Library of Medicine. Anybody can get into it. And you just look up, it's 23, pretty sure it's July. And what they talk about is facts of COVID. That's how they list it. And you'll be able to go through it, and maybe they can give you more of an understanding because they talk about studies that they did What happens is all research sets out with a hypothesis. So what's the hypothesis in this case? That we want to make sure we find a virulent strain or strand on that genome and be able to manipulate it in such a way that we can now get portions of it, which are proteins, and those proteins then can be used for the vaccine. Does everybody understand the concept? Okay? And again, guys, I'm independent with everything. I'm still an independent physician, and I mediated the kids, and I still look at it that this makes the most sense to me as to what happened. Because I can't imagine the bat blood dropping in, you know, you're eating that, and all of a sudden it's the most virulent virus that's ever been seen, because they do this all the time. You know, you guys might know my Chinese nurse practitioner, Holly. She knows the area. She called it, like, that's why I said the strip district. She says people just go down there, they think there's something in it that'll help them. She said a lot of the Chinese people have these superstitions, so they have these different types of animals that are literally hanging up. And then you pick one, and they go over with a bowl of rice, cut it, and it bleeds, and you eat that. So again, that was, I believed it. I mean, it made sense to me. But now when you look at the virulence, and what were they doing in Wuhan? Finding the most virulent part of that genome. So it could have been a lab accident. So those are the two theories that are out. Now, with all that said, pandemic. Worldwide. How do we prevent? Polio, measles, different things like that in the earlier years that came out. Actually, the guy at Pitt, you know, was the guy that came up with the vaccine for the polio. So these researchers have the understanding of the virus, and they understand that virus can't live on its own. It has to have a host. What's the host? DNA. That's what it's all about. It's DNA and RNA. And they have the RNA, they can replicate. So what does that mean? If we've been exposed to it and the virus is in your system, it could replicate it. That's why they called it long COVID. You guys remember that terminology? Because there were some people that got it and it stayed. How do we know if you have long COVID? Taste and smell are big. Big. What does that mean? That means if you had a change in the taste and smell and it still hasn't corrected and it has been a while, then just get checked. Because now the blood work is out there. It's real simple. They can see if you have antibodies that your body's making, fighting this off still, and that can give you better health, if you will, just from the vantage point of you have a negative blood test. Okay, I don't have anything, forget that. Or if it's positive, it's treatable. So again, taste and smell are big. Fatigue is big, but we all know everything's fatigue. Man, they must be after me. Sorry, guys. I give my first story of the day. So all of you guys that thought I was in Florida on vacation last week, no, okay? My wife took a new job. She's independent as well. She's a doc. So she took a job in Florida, okay? So she says to me 2 weeks ago, you got to drive my car to Florida. I said, okay. I said, can't we send it on a train or something? You know, well, that'll cost $400. Well, it cost me that in gas, right? But that's okay. So she gets home, we get in the car. I'm saying, how do we get to I-95, right? She goes, oh, we got to go to Geisinger. That's where she did work. And I go, oh, you didn't tell me that. What are we doing in Geisinger? We got to move the house in Geisinger. So I show up at Geisinger, and there's moving guys with the U-Haul, and they have a trailer for me to put the truck on so we can take it all down to Florida. So I packed up stuff with boxes, moved them all over the place, and then because there were no beds or furniture, we slept on a mattress, okay? So the whole process had me thinking that you didn't tell me the whole story, okay? So as it turns out, the drive down to Florida Have you guys ever been on I-95, the traffic down at I-95? There's 10 lanes, 5 on each side. So I'm driving this thing, and they have an express lane that says you can only have 2 axles, front and back. I thought I'll pay the ticket because the traffic was ridiculous. So I get pulled over, and I get a ticket. And so what did I say? I said, she said she didn't know. And what happened now is my wife's making me move my daughter who's in Florida, who's coming back to Pittsburgh. So that was my story for I don't like Florida. And it turns out the people are wonderful. All right, now, fatigue, guys, I want to bring up because I didn't believe it till I saw it. There is such a thing called chronic fatigue syndrome. It's related to a virus and a bacteria, 2 common ones. Anybody have mononucleosis? It's called the Epstein-Barr virus. Lyme's disease. Both are real. I have a good friend, Joe Joseph. He's the guru on Lyme's disease. He's in Sharon, Pennsylvania. So if you know anybody that has a problem with Lyme's and they're not getting rid of it, send him to Joe, use my name. He'll probably charge him double if you use my name, but he's a good doctor, okay? So what you want to know about these 2, one of the most common causes of chronic fatigue syndrome are these 2. And when it first came out and I got involved with it, was in the late 90s. And it was amazing. I mean, I found patients complaining of fatigue. And if we couldn't figure out what it may or may not be, we did these blood tests, and it was remarkable how you found, it's called a high titer. What does that mean? If your body's trying to fight it off, or it's rapidly dividing because it still has that niche to your DNA, then the levels go up. So it's a simple blood test. And so Joe Joseph, who I send my fascinomas to, calls me up and he says, "Man, how many, Lyme's disease are you seeing a month?" And I go, "A month? I don't know." I said, "I probably see a few a year." He says, "You're not testing it." And it's remarkable how if you check anybody that has fatigue, again, there could be other causes, not sleeping, you're working, all those different things, but if you can't put your finger on what it is, both the Epstein-Barr virus and the Lyme's bacteria can hang around in the body, and we find that it's real with the fatigue. The COVID virus causes GI upset, and it can be long-term. They end up calling it irritable bowel syndrome, and a lot of it got blamed on stress. I had a patient tell me her doctor told her to quit watching television, because during the pandemic, I mean, everybody's watching stuff and they're becoming afraid, and he felt that it was truly just anxiety. And as it turned out, we tested her and she did have long COVID. Again, guys, that's why I'm right to tell you it's for real, okay? Rash that doesn't clear, it's not psoriasis or eczema. That means if you didn't have it beforehand and now you have a rash, get the blood test. Check the test is what I'll put, okay? Musculoskeletal. I have patients that feel they're weaker. The patient is an avid golfer, and usually around this time of the year, he's telling me and bragging about his swing and how wonderful he's playing, and he needed my help to get up on the table, and I thought he fell or there was a problem. And he said no, and as we talked about it, he didn't do anything all winter, his wife had passed away, so depression and anxiety play a part in the long COVID. Have we figured out the exact mechanism? No, but it is being researched by the NIH, and if you look at that article, it talks about that a lot of the findings with the long COVID, you see people are very stressed. And once again, the television was part of that. Like when it was all going on, you're hearing the data, you're hearing the people that are passing away from it, and it's just one of those things. They tell you avoid it if you can. If you need to watch, just watch morning, afternoon, and evening. But once again, it's another cause of the long COVID. And again, what we see, musculoskeletal, the most common thing is getting up out of a chair. What happens is if you generally push off or do different things, you'll find yourself not feeling that you have the strength in your legs and feeling like you're going to fall. And once again, I've worked it up, thinking the patient had something else going on, sent him to orthopedics, those types of things, and nothing was identified. Once we saw that he still had high titers of the COVID and he was infected, it was treated again and he's doing better. And the treatment guys, doctors are different. Most of them now are the monoclonal antibodies. Some people use some steroids. I would say check with your doctor to see what they use and what they recommend. And if there's any question, especially with the long COVID, infectious disease doctors are the best. And every hospital has a group. So whether it's Swickley, AGH, Passivant, wherever you go to, there's definitely infectious disease always there. All right, the other thing that we noted, long COVID, and this is without taste and smell changes. Weight loss, early satiety. That means if you normally eat your plate of food and now you can't finish that plate of food, that's early satiety, that you're getting filled up quicker. And if you find that you're eating, you're doing everything you normally do, and you're still losing weight, that's the GI component to it. Other one, incontinence. Most common, bladder, but still can be bowel. So I'll put bladder, bowel. Similarly, your body's immune system attacks it. If it's still in the system, then all those cells are fighting it off, as opposed to regulating what goes on GI-wise. So you absorb in the small intestine, which I always like to say, mine's about from here to George, because it's all wrapped up and packed in there real nice. All the colon does is contract and absorb water. But what you end up with is if it becomes an infection and a chronic problem in the small intestine, it can also go to the large intestine. So again, I've had patients get scoped. Everybody tell them everything is fine. We check the levels. We see they're elevated. We get them treated. They get improvement. Are they perfect? I would not say they ever go back to perfect. But it's just like taste and smell. I have patients say it's never going to come back. And then they find like a year after that, it comes back to normal. It just takes a while for your body's immune system to catch up. All right, so the other thing that I wanted to do in terms of COVID mystery, make sure you read those articles, guys. All right, so what we want to make sure of is everybody understands the RNA. It needs a host to divide. Wow. Sorry, guys. I must be my bookie. And that's usually the DNA component of that, okay? How did we get it so virulent? We'll put a question mark to that one. Long COVID, okay? Now, the data that's coming out is that there's another mutation. What's a mutation? What a mutation is a change in the genome or a change in your genes themselves. So we get the chromosomes, we have the chromosomes, they map out your body's everything. And what occurs is, for some reason, what's that reason? It could be related to other medications. I've had patients, my mother was a patient, she had colon cancer, she took the chemo, she lived 10, 12 years later, but eventually it caused mutations and her blood count couldn't keep up. but she had those 10 or 12 years. That's always the balance between good and bad treatments with side effects. But what it comes down to, what you want to pay attention to, is the data that's out there is coming to show that the next mutation, and they say it's happening as we speak, is going to change in terms of symptoms that they see and how it gets transmitted. So they found this one was respiratory droplets. That's why we all wore masks, okay? This one now, they'll come up with, that information will come out. Guaranteed you guys have the information before anybody. You always do. And they'll always know what to do ahead of time. You guys were doing the first test. I remember I came up here one day and they swabbed my nose before I even walked in the door. So you definitely have all you need for prevention. And that's what the pandemic did. It enabled us, it was a global problem, so it enabled us to catch up with all the things that we need to do to prevent problems. So you have to have the supplies you need, you have to have everything. So what you want to do is, as the data comes out to the new strain, this place you'll have no problem. Friends and families, you make sure you tell them, talk to their pharmacy. Whenever they hear it, because the pharmacies are probably first line in terms of getting the vaccine. They get it before docs do. Okay? And what you want to understand is that's not abnormal. Okay? Make sure you don't look at this like, oh, COVID's back, we're in trouble. Remember I told you the first two. 10 people died. That was from 2002 to 2015. So once again, the coronavirus had never been this virulent before. This new strain that's coming out, I think they would have already warned us if they would have felt that it was a virulent strain. But just like I tell patients for the getting the vaccine for the flu, you know, we look at global data, we see, you know, they start out bivalent, then it went trivalent, now there's actually 4 different things in it. So what they look at is they see what's attacking the world, they look at the genome, and they manipulate it so that they can make the vaccine to give us all, so that if we get exposed, you still may get sick. I have patients that tell me, I got the flu even though I got the shot. Well, you might have not felt well, but without the shot, it could have been worse symptoms that you had. So what you want to make sure we pay attention to, talk to your doctor, listen to what they tell you here, because I'm sure they'll be on top of it. And what we'll end up with is whatever that genome shows will become annual data. Remember I started telling you it's data. That's what you want to look at. And again, guys, don't forget AI is here, artificial intelligence. So believe me when I tell you, it will be here first, and just follow the guidelines. That's all you have to do, whatever they tell you. Like I'm sure lately, you know, it used to be if you had COVID initially, you were in the hospital or you had to go see the doctor, and sometimes they even put people wherever they needed to put them to isolate. You know, now, you know, if you're not ill and you happen to get it again, 5 days just to make sure you don't infect somebody else. You know, so all that information is being developed. It will all come out ahead of time. I just wanted to make sure that that's why I said in the title that the data is what you want to look at. Make sure you know. And don't listen to the TV, listen to your doctor. I don't say push it, I recommend vaccines for people that have immunocompromised systems. If you have lung disease, bad heart disease, I think we used to say if you're taking more than 12 medications, you need to seriously think about it. And those are the ways you look at it that make certain you protect yourself. All right, so now what we have is what happens in the community. You guys don't have anything to worry about because you're here. They'll do all the stuff they need to do. Okay, will they close stores and change our daily routine? The data that's out there is no, because it's not virulent, as virulent, okay? So all I wanted to do was make sure you had the information. Please make sure you understand the RNA, how that works, guys, because that's what's going on in in these viruses as they divide. And once they get you as a host, they don't want to leave. So make sure if you get it, you get checked, you prove that you have it. If you're healthy, quarantine for 5 days. If you're not, take the medicines that your doctor recommends. Do you need to recheck? No. As long as you do what your doctor tells you, you should be fine. But please make sure that you pay attention to what's going on in the community, because you have to see and pay attention. You guys will get all the information, but what we didn't have before, I think it was a church, one of the churches in the North Hills. How it ended up was they had them come in, they paid attention to the details, but apparently they had an outbreak at one of the churches because people were taking their mask off, like going up to communion or something, whatever it was, and they put those two together. So pay attention to what's in the community. Now, from my end of it, the last thing I'll leave you with that you want to know, viruses. Transmission. Hand washing. Hand washing is the most important thing, guys. And it's funny, I have a couple students with me. I can tell you another story. I don't know if you guys knew Dr. Mehta. Lou Mehta was an oncologist. He trained me at McKeesport Hospital. And so the first day on rounds with him, again, he was an oncologist, so these were like sicker patients. So I come walking in the room, door was here, you walk in, bathroom, patient's room. So I was leaning against the wall like this. I probably wasn't even leaning, probably standing for a while, but he would talk. So he's talking, and the lady's holding her belly saying, "Shut up, Lou, you're gonna make me pee my pants." So he has her laughing. So I'm standing, like I said, against the door. He goes into the bathroom, washes his hands, and as he comes out, I start to walk, and he punches me, knocks me against, well, he knew my father, punches me and knocks me against the wall. And I said, "What did I do?" He said, "You didn't wash your hands when you walked in, and you didn't wash your hands when you walked out." And he just looked at him like, I'm looking at him like, "What is that?" "I didn't touch the patient." You're in the room, germs. That's what that means. So you have to have good hand washing. I can't emphasize that enough. And that stuff you squirt on your hands, not enough. All that is alcohol and some other stuff that's in there. That just dries them up real quick. Give yourself a good hand washing. I recommend even twice. And again, you have to be a neatnik and clean everything. It doesn't hurt. My wife would spray everything down. She had those little towel things that you write down. She sprays Clorox, all that stuff, and then that stinky stuff, ammonia everywhere. I don't think you have to be a fanatic, but please, please, I'm emphasizing, hand washing is the most important because it's droplets. You cough, most of us cough into our hands or somewhere. Make sure you do that. It's one of the best preventions that you can have. Okay, the other thing that I talk about for transmission, and I push it all the time, water. Increase your water. Why? Mucous membranes are where the germs get in, okay? If you're not hydrated, the mucous membranes are open. Those pores are open. So what does that mean? If you sniff in and you're well hydrated, nothing's getting through. If you sniff in and you're dry, everything's getting through. Now you have the immune system of your body, your lungs. I mean, it'll definitely be activated. I'm not saying that it's that dangerous, quote unquote, but I'm telling you, that's the most important thing for you. Wash your hands and water. I'm not telling you to go buy a $100 medication. I'm not telling you that you have to, isolate yourself. Those are the two biggest things that we've seen transmission-wise. Because, like sniffles, especially if you get a cold, you use the Kleenex or the, whatever you're using, blowing your nose. But yet generally, once you finish, you can still get stuff on your hands. And if you don't wipe it off, you can end up you can get it yourself or you can transmit it. And we all think we're clean and neat, and we are probably, but when germs are out there, be extra cautious, okay? So hand washing and water. The last one I leave you with, please consult with your doctor. And if anybody's a pharmacist here, I'm not picking on you. Not the pharmacist. For treatment. Those of you with lung disease, the inhalers that were aerosol, not dry, and not the nebulizers, the mist, but the ones that were just the aerosols. They found primatine mist was one of the ones that ended up, let's just say, not opening the lungs and helping clear the mucus that had the virus, but actually trapping it because they found that there were some spasms with it. They call it a bronchospasm. So once again, I'm not necessarily opposed to over-the-counter stuff. Wherever you get your information, there's a lot of people out there. Integrated medicine is for real. You know, there's a lot to do. I use a place out in North Park called Pharmacy. They spell it F-A-R-M, Pharmacy. You go over the train tracks when you go through by the Dairy Queen, and it's awesome. I mean, I sent my mother there when she couldn't eat after her chemotherapy. They have all kinds of herbs, and the guy there knows what he's talking about. So I'm not against those things, but you have to make sure, like this guy has a PhD. Like you don't just read an article, or you just don't listen to a friend that says, oh yeah, my aunt had that and she took this and felt fine. I mean, you can do it if you want, but if we get to a point there's something else going on, don't put anything in your system that you don't need to put in your system. And I mean that, guys. Like if you drink a gallon of whiskey a day, drink a half a gallon. If you smoke 50 cigarettes a day, smoke 25. Like cut everything back. You want to put your body in the best immune protected way it could be. And I'm telling you, these are all basic things that I think we take for granted. I mean, it's one of those things that we've all been well, we've all had, you know, whatever we've had and got over it. No one pays attention. And again, I'm not trying to scare you because this is less virulent. All the data shows it's not going to be as strong, but I still want everybody to be prepared for it. So when you hear about it, wash your hands an extra time, please. Drink so much more water. You guys, talk to your doctor, I shouldn't say that. If you have liver disease or kidney disease, you may not be able to take water. If you're on a restricted water amount, then I'm not telling you to drink the water. I'm just saying in general, hydration helps the mucous membranes protect you, especially from the respiratory droplets. So please, please pay attention to that. That's so important. Okay, so I have nothing against pharmacists, remember that. But if you get the problem, no over-the-counter for your treatment alone. Now, if you've spoken to your doctor and you've got a prescription and you go in the pharmacy, you say you're having an upset stomach from the pill or whatever, and your pharmacist says, oh, IL-4, get so-and-so, it'll help the stomach. I have no problem with that. They're intelligent people, they understand. But I want to make sure that you talk to your doctor and you get whatever the treatment happens to be. You know, again, they call it, the way nowadays everything works is in the lab. And so what they're able to do with the antibodies is stimulate your body's immune system to help protect you. So these are different treatments that we had out there, and I've had many patients have them without any problems whatsoever. So listen to, because we get it all from the CDC. So we'll get a paper from them saying, okay, if the patient has so-and-so, such and such, this is what we recommend. So you'll end up with prescribed by doctor. I should just say doctor. Please make sure of that. And then if you feel worse with the treatment, please be seen. What does that mean? I mean, if you have to go to an urgent care or something, that's fine, but don't just write it off that it's all just the medication. Because I had that problem with the COVID. And a couple of these were young girls. You know, we lost a girl at one of the clinics that I worked at. She was only 35 years old. She didn't get vaccinated. She said she was fine. And then she did go to an urgent care. They checked her, told her she had the COVID, told her she had to isolate. I think they said 2 weeks back then, because it was right back, I think it was in 21. And long story short, she didn't follow what they told her to do. She was a smoker. She got pneumonia and she passed from it. And those are the things, that's why I'm emphasizing all this to you, because the data that's out there shows a less virulent strain. It's not in America anywhere right now causing any trouble, but when we know it's someplace else, it's coming. And that's how they do these things, is they predict them. And so what you want to be sure of is that you're prepared. So please, I don't mind what the pharmacists say and do if you have side effects. No problem with that. But if you don't have a new medicine and you're feeling worse, that means the doctor prescribed the medication for you, you took nothing else over the counter, just your regular medication, and you have the sense of you feel worse, get back to the hospital. Because we've had that happen as well, where the patients were seen, I would have seen them, pulmonologist would have seen them, treatment gets started, and then they make the call, but we all blow it off as if, oh, it's nothing to worry about, it's probably just a side effect of the medicine. No, especially if you're just taking the medicine that the doctor prescribed, because he or she will tell you what side effects to look for. And so if you're told, like, okay, you're gonna take these pills, you might get some heartburn, you might get some diarrhea or constipation, you might have some muscle aches, and now all of a sudden you get real bad back pain, or you get hiccups, or you get things that you just know aren't normal for you, please, please call your doctor, okay? All right, guys, and the last one, last but not least, I've been saying that for 10 minutes, I know. Genome, we all have. Genetic testing is coming. It's also one of the biggest scams that's out there right now if it's not professional. So if anybody calls you, talks to you, sends you information, and they want to tell you, and they use the word genome, okay, and that's truly what it is. There are companies out there that are legit, and they will go through and they will tell you based on your genetic makeup, are these pills effective for you, or are there something out there better? I've had patients see them, I trusted them, made some changes. I don't know if they felt a whole lot better, but they felt better. So they are out there. I'm afraid that especially with what I just told you, now that it was in Newsweek and all the information starts coming out, that might be a way that comes out as a fad more than as something that's going to help you. Talk to your doctor, please. If I had a patient that called me up to say that, you know, they want to see such and so, you know, company for X, Y, and Z, what I would tell them is, who's the doctor running it? Make sure there's a doctor that's running it. You know, it could be a DO, MD, chiropractor, but make sure that's there. Like, you don't want to ever go to any, like these weight loss places. I have people that go in and speak to different people for weight loss. They end up taking pills and things that, these aren't doctors. So please make sure you pay attention to that. And let's hope this thing stays nice and non-virulent. It's not a problem. But again, guys, like I said, when I read the article in January, it just opened my eyes that I wanted to at least look through the data. And there definitely was gain of function. But again, it's to find the virulent part of that genome to help make the vaccine that will protect us. I don't believe all the theories that are out there that it was some kind of a thing that was gonna take people's lives. I just believe that it was probably an accident in the laboratory, because I have a hard time believing that it was the bat, and that it wasn't, because of my daughter, the veterinarian said that you would have seen something in the bats over a period of time before that. So that was why I wanted to make sure I gave you the facts that are there. Again, the NIH, Library of Medicine, July of 23, and Newsweek, January of 2025. Because they will tell you everything I just told you. Well, maybe not everything, but a lot of what I told you. It's like, oh wait, I gotta think of a good joke for you. Here you go. Why don't crabs volunteer? They're shellfish. Come on, that was a good one. Made me laugh again.